The biggest nursing strike in NHS history looks set to happen before Christmas, after more than 300,000 members of the Royal College of Nursing were balloted over the walkout. It'll be the first strike action in the union's 106-year history.
Yeah, and according to our Twitter poll this morning, it is well supported. Nurses say they feel undervalued and are demanding a pay rise of 5% above inflation. But is a strike the right way to achieve this at a time when patients are already facing record waiting times? Joining us now, Conservative councillor Noah Kigali, who says strikes are not helpful for patients or indeed for staff.
And Donna Hales, a clinical specialist nurse and Labour councillor, who says a strike is the only option. And let us start with you, Deborah. Donna, sorry. Is this? I apologise. Is this really what nurses came into nursing to do, to withhold their labour?
I think the fact that we've never withheld our labour, in essence, for all the time we've been in existence, we've tried to avoid doing things like this, says something that we're actually prepared to do it at this stage. So no, we didn't come into the profession trying to do this at all. Donna,
what do you think the impact will be? How is this strike, do you think, going to be organised? Because, as a viewer, if I am taken into A&E on the day of a nurse's strike, what does that mean for my care? Or if I'm waiting perhaps for a chemotherapy appointment, what will it mean for my care? Or if I'm on a waiting list and currently my appointment isn't for a year, what will it mean for my care?
OK, well, there's a lot of questions there, Susanna, but in terms of emergency care, all emergency care will be provided. Patients that are scheduled for chemotherapy will have those appointments rearranged or be about around the same time. So nobody's going to go without essential care. In terms of elective surgeries and outpatients appointments, they're the most likely ones to be affected. But let's get real here and be really honest. These appointments are already being affected at the moment because of the shortages that we've got. So it's not unusual for an elective list, say hip replacement, knee replacements, to go down because there aren't adequate staff. That's not just nursing staff, that's also medics as well.
So is part of your proposal to strike not just about a pay rise, but about the fact that there aren't enough staff in the NHS? If you pay staff more, you're more likely to recruit and retain.
Yes, absolutely. And that's probably the key essence to this now. Nurses overall in the last 12 years have lost about a third of their pay because they've had below inflation pay rises. So that has had an impact on things. However, what we're really looking at is recruiting and retaining staff. And those targets that have been set have been repeatedly missed. We can't recruit and retain staff enough. Okay. At the moment, because of pay and because of poor working conditions, 1 in 3 nurses are planning to leave. Now, when we talk about poor working conditions, we're talking about areas that are grossly understaffed. We're talking about staff having to work extra hours. We're talking about staff having to go without breaks. Some staff having to have annual leave cancelled. And also things like development and training are affected because, if you've not got enough staff in your area and you want to do a course...
Well, let's put that all to Noah Kigali. You're a political commentator, also a Conservative councillor, Noah. From what Donna's saying, nurses are at the end of their tether. It's not actually just pay.
I think we can absolutely agree that there's pretty serious problems in the NHS, and specifically for nurses. I think as a country, we've all seen the massive role that they play in keeping us all safe and healthy. But my problem is, and what I'm scared about, is the fact that international data, so take New York from 30 years ago, is probably the best data that we've got, suggests that there's about an 18% rise in in-hospital mortality when nurses go on strike, even if emergency care is still provided. There's also about a 6% rise in readmissions, which is smaller, but still not good. And we need to be honest about the fact that these things, despite everyone's best efforts, would happen if in the event of a nurses' strike, and it will be essentially punishing the public for something that they've not really been at fault for. But nurses do need to be paid better and have better.
But who is at fault? I mean, there's not been a strike for over 100 years. Margaret Thatcher had strikes with the miners, There have been strikes. When I was Education Secretary, there was a teachers' strike. But there's never been a nurses' strike because governments of all colours have always decided to make sure that they invest in the NHS and they support our nurses. So why has it come to this at this point, and who's to blame?
Absolutely. So I think we need to start, again, being honest about having a national conversation about the state of the NHS and where it needs to go moving forward.
But what's the answer to my question, though? What's the answer to my... Go on. I mean,
2015,
who is to blame for this now?
In 2015, you promised 2.5 billion for the NHS in that year if you go to win the election. We've had almost 5 billion every year since then, and we still see these problems every year. Fundamentally, our hospitals are not working, and it's punishing the people that work there and the public. We need a national conversation about how to reform the NHS and move forward to ensure that people do get paid better, have better working conditions, and have better results. Because constantly at the moment, we're sticking these short-term fixes on the NHS, on pay, for example, and hoping that the problem goes away. We'll throw some more money at it next year, and then we end up with these bigger black holes and results that are not actually justified by the amount of money we're throwing.
So there's been 12 years of Conservative government, 12 years of short-term fixes. There's now a bigger black hole. That's quite a thing to say for a Conservative councillor.
You go back to 2008, this is an NHS problem. If you stick NHS nurses numbers into Google, you get an article every year from 2008 about how we don't have enough nurses. It's not the amount of money at this point. It simply can't be. There's been almost 80 billion invested in the NHS since you said that, Ed. And this, we have to be really honest here. It's really hard to go into an election going, look, there's this really complicated issue that we keep kicking down the road, but we really need to deal with it for the sake of patients and for staff. But it takes something from all of us, from both sides of the political spectrum, to stop pointing fingers and saying slogans and genuinely deal with the systemic issues that are there.
Donna, just before we let you go, I mean, Noah's first point was that people will die. You know, even if it is a small proportion. I mean, is that something you're prepared to take the risk?
Well, the thing is that people are dying now, Susanna. You know, our mortality rates, if Noah looked at the figures of mortality rates over the last 5 years, particularly, they are rising anyway because we just don't have adequate staffing levels. You know, I totally disagree with the idea that we just throw money at things. You know, the government itself has got the Health and Social Care Committee, which was actually headed up by Jeremy Hunt. And over the past 2 years, they've been repeatedly saying that there's not enough being done about recruitment and retention. You know, we have to keep these skilled staff. You know, you just can't pick somebody off the street and make them a nurse. People are really skilled and highly skilled, and they're highly clinically skilled as well.
All right, Donna Hales, thank you very much indeed. Noah Kigali, thank you.